YouTube, we do have a quorum with 4 members, so we can start as soon as she's ready.
Who are we missing?
I don't see Gallagher.
Gallagher's on.
Oh, he's there. Sorry, I see him.
Oh, wow.
I am so sorry.
It's a lot of people on the call today, Gallagher. So I know it's not personal.
That's okay.
I'm sorry, Mike.
It's the hat, Mike. It's the hat.
Started my day off badly.
Now,
Hi, Janine, the meeting is streaming live now, so you can start whenever you're ready.
all right. Good morning, everyone. Happy Tuesday. Today is Tuesday, February 2nd, 2020. I want to wish everyone a happy Black History Month, and I'd like to call the meeting to order. Council Clerk, will you please call the roll?
Calling the roll, Ms. Brown.
Here.
Mr. Gallagher.
Here.
Mr. Miller.
Here.
Ms. Conwell.
Present.
Mr. Sweeney.
Present.
We have a quorum. Also like the record to reflect that Councilmember Jones is also in attendance.
All right.
President Jones for joining us today.
Thank you. And congratulations, Denisha.
Yes. All right. Do we have any public comment?
No, Madam Chair, no one submitted any public comment.
I'll just take the point of personal privilege and again congratulate Donisha Green and use that as a time to celebrate. I also, just because we haven't done this in a while, just want to give a brief moment of silence for all of those lives that have been lost to the pandemic. We are approaching 500,000 very rapidly, and I think it is worth just giving a moment of quietness to think about the lives that have been lost. So if you will join me in that. All right, thank you very much. We have the minutes before us from the January 19th meeting. I'll make a motion to approve. Do I have a second?
Second, Miller.
Been seconded by Miller. If there are no questions, comments, or concerns, all in favor, please say aye.
Aye.
All right, the meeting minutes have been approved. Council Clerk, if you will read the first item into the record, please. And before we get started, I just want to let everyone know we have quite a full agenda, a lot of candidates before us. So in the out of respect for time and the hope to be as efficient as possible, I'm going to respectfully request that you keep your opening remarks to 3 to 5 minutes tops. And then we'll open it up to our colleagues for questions. Some of you are familiar to us and some of you are a little less. So if you'll just give us the courtesy of, again, being mindful in this world of Zoom, I'm sure all of us have multiple Zoom meetings that we have to attend as well. So if once you have given your presentation and the council has no further questions, you are free to exit the Zoom call. So I just want to put that before all of the individuals on the call this morning, and thank you for joining us. It is certainly our privilege, and it gives the residents of Cuyahoga County an opportunity to recognize the individuals by face that we are nominating. So when you come to these committee meetings, it is greatly appreciated. It's a tremendous value. So with that, I'll turn it over to the clerk if you'll read the first item into the record, please.
Resolution number 2021-0039, confirming the county executive's appointment and reappointment of various individuals to serve on the Cuyahoga County Advisory Board on Senior and Adult Services for various terms.
All right, thank you very much. At this point, I'd like to turn it over to Director Pomerantz, if you'll give us a little bit of background and share with us the makeup of the committee as well. Director Pomerantz.
Thank you, Madam Chair. The Cuyahoga County Advisory Board on Senior and Adult Services is the board that we're recommending all of the folks that are on Zoom today. This board consists of no less than 10 and no more than 25 appointed members. Each member will serve a 3-year term, and we are pleased to bring forward 2 reappointments and 15 new appointments. Madam Chair, I'd like to just read their names into the record. For reappointment for a 3-year term, Mr. Bill Hibble. For reappointment for a 3-year term, Carolyn Lookabill. A new appointment, Dr. Victoria Winbush, a 3-year term. New appointment and unexpired term for Denisha Green. A new appointment for Mark Batson, Katie Boland, Yvette Bozeman, Christy Groves, Yvonka Hall, Kathleen Halsey, Julie Johnson, Janet Keeler, Janet Montoya, Shannon Monyak, Douglas Tayak, Kim Thomas, and Bishop Eugene Ward Jr. Those members, I believe, except for Ms. Montoya, are part of the Zoom meeting today. And we have also invited Maridel Couture who represents the Department of Senior and Adult Services to also speak to the matter.
Thank you, Director Pomerantz. I'll open it up to the committee if they have any questions for the director regarding the appointments or the makeup of this body. Okay, if there are none, then I will bring the first candidate up for appointment, and that appears to be, we're going to go in order, Donisha Green, who is replacing Cameron Harris. All right, Ms. Green, if you will share with us, if you'll state your name for the record, share with us your background and why you would like to serve on this committee.
Morning, everyone. My name is Donisha Green, and I am currently serving as the field representative for the Office of Congresswoman Marsha L. Fudge. I am absolutely interested in joining and serving on the Cuyahoga County Advisory Board of Division of Senior Adult Services, because for me, I believe in the importance of improving the overall quality of elderly and those living with disabilities. Having had the professional experience of serving with Cuyahoga County for over 6 years inside the Cuyahoga County Executive's Office, I had the opportunity to work very, very closely with the DSAS team with all sorts of advocacy awareness campaigns. And I think from that experience, it led me to understanding why it's important to have that network of high-level care. And so in my work now, I spend most of my time, my portfolio covers healthcare, hospitals, Social Security, housing, ADA disability. It runs the gamut of all Health and Human Services. And again, because of my previous experience working inside Health and Human Services and connecting with all sorts of agencies and organizations, I think that my position would lend itself well on a federal level to help with sharing messages at that level and connecting them to the committee board. And to be honest, DSAS is one of my favorite agencies to work with. I think they do amazing work. I'm happy to see that their budget has increased, and so their care and expansion in hand is also expanding as well. But I'm really excited with the opportunity, and I'd love to join, and hope you guys feel the same way.
Thank you very much. All right. Well, many of us are familiar with you having worked here at the county, as you mentioned. So I'm going to open it up to my colleagues. If you have any questions, now is the time. And I see Mr. Miller, Councilman Miller has unmuted himself. So I presume you have a question, Councilman.
Yes, I do. Thank you very much. And I would like to add my congratulations to you, Denise, on the addition to your family.
Thank you, Councilman.
And also to thank you for all the excellent work that you do and your willingness to step up and serve on this committee. And my question is, from your perspective in the congressional office and your experience with healthcare, what do you think would be the best strategies to help senior citizens in our community access COVID-19 vaccine appointments? The process is fairly difficult right now.
Yeah, I think what's happening now is helping considerably. I've been on calls with all of their government advocacy people. At this point, we're on every couple weeks, every couple days calls, depending on the situation. We recognize that there's a challenge, but for them on a federal level, they need more funding. And so that's the message that they're echoing. I think there's some guidelines and restrictions that they'd like to see restricted so they can do more work. And so that message is continually being pushed up to the DC space, so they know that this is important to our hospital networks. And so those conversations are happening right now. And I think they need to continue to happen because we're in the process of continuing relief efforts. And so if we can, working with Cleveland Clinic, working with Metro Health, and even down in Akron, you guys don't care about that Akron so much, but again, those are important conversations that are happening. And if we can continue to share those messages, I think that it will have good outcomes.
And by way of follow-up, what do you think can be done to help senior citizens in our community be more able to navigate the system and get appointments?
Well, again, working with the agencies that are at the head of those, they need more funding. And I think that that's the number one thing that we can help with at this point, because I think that because the funding is an issue, and they have some of those restrictions, it's preventing them from, having the awareness that they want.
Okay, thanks very much.
Thank you.
Thank you, Councilman Miller. Are there any other questions for Ms. Green? All right, Ms. Green. Well, I think your reputation precedes you, and having worked with us, it has been a good thing. So it may appear that you have gotten off easy today. So with that said, we thank you for taking the time to join us.
Absolutely.
Yeah, we're going to move on to our next nominee, which is Dr. Victoria Winbush. Dr. Winbush, if you're on the line, if you'll unmute yourself, state your name for the record, and give us a little bit of your background as to why it is that you would like to serve on this body.
Thank you very much, and good morning to all. Thank you for this opportunity to be nominated to serve on the DSAS board. I currently am a full-time faculty member at Cleveland State University, where I teach in the School of Social Work. I'm also a licensed social worker in the state of Ohio. And over my many decades of my career, I've provided mental health services, some of whom have been older adults, as well as very early in my career, I served as the coordinator of a senior daycare program. So it's kind of like this has been a thread throughout my career. One of the things that I'm most proud of is in the spring of 2019, on behalf of the School of Social Work at Cleveland State, I reintroduced the day-long Anna V. Brown Community Conference and Forum. Some of you may be aware of it. It's specifically focused on the needs of the Black elderly. It's a program that had been initiated many years ago by Dr. Ed McKinney, Dr. Mike Williams, both who were faculty members at Cleveland State. And it had gone on pause for a while, but we were successful in really gaining interest from our partners, one of whom was the DSAS organization, to support us in presenting that. And I think it was very effective. It was pre-COVID, so it seems like a long time ago, but it really wasn't. And people were very grateful to be able to have that focus again. And one of the things that we did that was a little bit different this time was we had a poster session where we had students who were involved across different fields, including social work, but looking at nursing, pharmacology, because what we know is that to provide quality care in today's world, it has to be an interdisciplinary approach. And that's also something that I emphasize in terms of my current role as a full-time faculty member at Cleveland State. So I teach a number of courses, such as trauma and recovery, working with groups, building effective relationships with groups, organizations, and communities. And one of the things that I'm, very interested in emphasizing across all these courses is the needs and interests of the elderly population. Because one of the things we know is that our elderly population is growing, and the number of professionals who choose to work with elderly is not growing or keeping up as quickly. So I think the more that we can do as educators to bring to attention the needs of this population group, because sometimes students don't think about that, I think we'll hopefully begin to catch up more. So in my earlier professional career, I was an administrative director in family practice at Metro Health. I also we served elderly. I was also a program manager with what was then the Cuyahoga County Community Mental Health Board. And there I was responsible for implementing a plan on family caregiving. And so of course the focus was on persons with mental illness, but again, that also includes the elderly. And I was also responsible for developing and implementing a cultural competence training program for administrators and direct service personnel at the mental health agencies who are funded by the mental health board. So that's also been a thread in my career, which is diversity. And I really do consider the needs and interests of elderly population as an important component of that. So kind of in summary, I would bring to the board my many decades of experience in working with service delivery system in Cuyahoga County as a clinician, administrator, program director, consultant, and currently as a college educator. And with that, really continuing to put focus and attention on the needs of the elderly population. So some of the opportunities that I think Cleveland State, as a university, we have field placements. We want to make sure that we put students in field placements where they can work with the elderly. We have interdisciplinary education, and often those case studies focus on the elderly. So we want to continue to do that. And also the research and just having students have coursework focused on the needs of the elderly. So thank you for your attention. And I'm certainly open to questions that you may have.
Thank you, Dr. Winbush. So the one thing that it's sometimes important for us to know, how did you learn about the position?
Actually, my colleague, Dr. Ed McKinney at Cleveland State, I would often have conversations with him. I worked closely with one of the staff members at DSAS, Denise Rucker-Burton. So I think that's probably kind of how I came to the attention.
Okay. Thank you very much. I'll open it up to my colleagues if you guys have questions. All right, well, it appears that your background and wealth of knowledge has served you well, and that my colleagues and I believe you demonstrate and have proven yourself to be a dynamic candidate for this opportunity. So we thank you for coming before us today and giving your presentation. We, again, given our lengthy agenda with a number of nominees coming before us, you've given an outstanding presentation. So if you'd like to stay, you are more than welcome to do so. But if you need to depart, then we understand that as well. So
I will.
Your willingness to come up and join us today means a lot. So we're going to move on to the third set of appointments. And these are for terms from January 1 to December 2023. And our next candidate in that batch is going to be Mark Batson. Mr. Batson, if you are on the line, I've seen you, if you'll unmute yourself and proceed accordingly. State your name, give us a little background, and tell us why you'd like to serve on this body.
Okay, well, thank you, Ms. Brown. Yes, my name is Mark Batson. I'm currently the Chief Operating Officer and Chief Information Officer of Step Forward, which is formerly known as the Council for Economic Opportunities in Greater Cleveland. I'll give you a little bit of that a little later after I tell about myself. I'm born and raised in Cleveland and educated at Kent State and Case Western Reserve University. Have spent primarily most of my career in government, nonprofit, and for-profit organizations. For the last 20 years, I've been a senior executive primarily in healthcare organizations here and in other parts of the country, and mixed in with a little public policy advocacy and in the areas of economic development and workforce. I primarily focus right now on operations for Step Forward, managing our operations, supporting our Head Start operation and our community services operation, particularly as it relates to seniors. Over the years, I've been instrumental in helping healthcare organizations offer access to seniors in the areas of Medicaid, Medicare, Medicare Part D, regarding the prescription programs that are available there. In addition to that, for a time I was privately consulting with Health and Human Services on a national basis with community health centers, and there was a number of situations where we supported seniors' access to Obamacare, to Ryan White services, and things of that nature. I also was in 2009 was the founding chairman of an organization in the East Cleveland area called the East Cleveland Bridges of Hope, which is still active in supporting seniors who have are caregivers for younger children and younger adults. So, I do have a particular interest in ensuring that seniors, are able to adjust themselves well to the society, especially as technologically advanced as it is, and a lot of the other challenges that are out here for them, so that they can, live comfortably in their senior years. And just one last thing, just as of last week and this week, Council for Economic Opportunities in Greater Cleveland, we have changed our name to Step Forward. If you know anyone over there that you're trying to get an email across to them, you have to go with the first part of their email and stepforwardtoday.org. The website is Step Forward Today, but the official name is Step Forward. So
Thank you for giving us that update as well as your background. You hit on something that is really an area of concern for myself and many of my colleagues, and that's kind of the digital divide as it relates to our seniors and technology. Do you have any firsthand kind of experience on how you've been able to kind of help and assist the seniors in that way, or any suggestions on how we might be able to implement a better strategy to bring our seniors into this new normal, if you will?
Yes, well, I'll give an example that someone was alluding to earlier about the vaccines, and then also just in general. The vaccines are, number one, it is, as a public health program, it is one of the most difficult things to manage for healthcare organizations anyway. So we just have to have a little patience with the process as it flows from the feds to the state to the local community, because giving people those vaccines, giving them one shot, then another shot, and the data that has to go back to the state and to the feds, so this record keeping is quite challenging. But as far as the seniors, I think it's a situation where you end up having to have boots on the ground, just like you do when you're doing other kind of grassroots types of campaigns. There is a lot of fear out there. Some of it's unfounded. I was just joking with a person the other day. They said, hey, everybody's saying that if you take the vaccine, they'll know where you are. And he was like, I told him that we're paying for that every month with the cell phone bill for them to know where you are, So, you got to kind of overcome some of the impractical aspects of people's fears. I think if you get out and touch people, and significant people they know do it, then there'll be kind of a bandwagoning effect. And then, just in general, on the digital divide side, it's like with anyone, you have to touch them. We need more services out there, to educate people almost like on a retail basis about how technology works. I'm a CIO, and I need my son to tell me about Roku, and every time the Roku thing goes out, I have to call him and have him come fix it, because I don't know how that works. And so all the different things and the way technology has expanded, we just need more information sessions that people can access regarding that. I was involved in the Digital Seas program where we help seniors and ex-offenders get access to technology through with the assistance of the Ashbury Community Center. And those people were amazed with their, they were very satisfied with the service and their ability to do things once they were taught. And they were very happy with the service, especially folks that were ex-offenders who hadn't accessed it, or older folks who now had the ability, just with some simple training on digital literacy, on how to access things that could support their lives better. So.
I think that's smart. Okay, I'll open it up to my colleagues if you have any questions. Going once, going twice. All right. Well, thank you so much. We appreciate you coming and your willingness to serve in this capacity. And as I said about the others, if you can stay, we certainly welcome you. But if you have to go, we understand that as well. So our next candidate is going to be Katie Boland. I hope I said that right. And if I didn't, please correct me and state your name for the record. Give us a little bit of your background and tell us why you'd like to serve.
Thank you. Good morning, everyone. And you did say my name right. My name is Katie Boland. I serve as the Director of External Relations at Eliza Bryant Village, and I'm very honored to be here today, so thank you for your time. Eliza Bryant Village is celebrating our 125th year as a community of care for older adults here in Cleveland. We are an anchor in the Huff community, providing quality care to older adults and their families through skilled nursing, an inpatient rehabilitation program, a dialysis center on our campus, an adult daycare program with a unique medical model, affordable independent housing, and a new elder justice center that offers free housing and support services to seniors experiencing abuse. While there are many mutual benefits of serving on this board, I will focus on 3 reasons that are special to the community of Eliza Bryant Village. The first reason is our mission. The mission of Eliza Bryant Village is to provide quality services, outreach programs, and a dignified, compassionate, and secure living environment for seniors. As we continue to navigate the changing preferences of older adults, families, and unpredictable situations such as COVID-19, we know that seniors continue to be a valuable and a vulnerable population. The opportunity to serve on boards such as this provides ways to recognize the importance of seniors in our communities and provides opportunities for ways to improve their lives in their golden years. Secondly, the Village values collaboration and innovation. For example, our Elder Justice Center is the only program of its kind currently offered in Ohio, and that was developed with the help of critical community partners. The Village has worked with members of DSAS over the years in a variety of events that are all focused on improving the lives of seniors. Eliza Bryant Village is also a member of Leading Age, which is a national and regional trade group advocating for the needs of older adults. With so many compassionate, connected, and talented volunteers on this committee, our community for older adults will continue to benefit from the ideas and improvements that this committee will certainly develop. And finally, as the oldest operating African-American founded long-term care facility in the country, as we begin Black History Month, Eliza Bryant Village represents the unique perspective of minority older adults. African Americans experience health, wealth, and social disparities at extremely high rates, and have lower life expectancies than other racial and ethnic groups. And African American nonprofits receive less grant funding compared to groups with white leaders. Last year, Eliza Bryant Village implemented a new strategic plan that included a new tagline or mantra that says, "One Village, inspired by traditional African American values, welcoming to all." It would be an honor to bring that perspective, values, and insights of the village to our community at large, Cuyahoga County. A little bit about me personally. I'm earning my master's degree in business administration from Cleveland State University. For nearly 10 years, I've worked in areas that serve our community and our residents. I worked at the Village for 4 years in marketing and fundraising. Before that, I served at the Alcohol, Drug Addiction, and Mental Health Services Board, creating awareness for programs and services. I volunteer on the American Marketing Association and the Association of Fundraising Professionals, and I'm an active member on the Council of Older Persons, which is an amazing group here in Cuyahoga County. So in closing, I thank you for this opportunity to be here today to represent Eliza Bryant Village, and I do hope to serve on this committee on behalf of more than 1,000 seniors served at Eliza Bryant Village each year.
Thank you very much. So if you could tell me, you may have mentioned it, how long have you been with Eliza Bryant?
For a little over 4 years.
Okay, and your current role with them?
Is the Director of External Relations.
Okay, all right. Just wanted to be clear because what really caught my attention is some of the data, or at least the highlights that you mentioned relative to the challenges with grant funding. Do you assist the organization with that? I know you said that you did that in the past. Was that a past role, or is that something you currently are working with?
I currently work in the development department under the Chief Philanthropy Officer. So I do facilitate some of the grant management and applications for the village.
Okay, awesome. And so my last question, given the challenges with COVID, I know the senior facilities were put under some very tight restrictions, but you also mentioned you do dialysis. I'm not familiar with the village or the campus. So how were you able to manage the senior population as well as individuals that had to come in and out to get those services?
Thank you. That's a good question. So all of the services that we offer are located on our 17-acre campus in the Huff neighborhood. So our skilled nursing home, we had to abide by the regulations for the safety of everyone brought by COVID. So we do COVID testing twice a week on residents and staff. And we've restricted, in the beginning of COVID, we did do some outdoor family visitation safely. We moved that indoors. And then as more cases started to come in for the safety of everyone, we prohibited any non-essential visitors to the building. And we've made accommodations with grant funding for increased technology to do FaceTime between family and their residents. We've had a lot of support from the community with handmade cards and gift donations to the seniors, which really just mean the world to them during this time. The dialysis center is on our campus. So if and when residents need to go get their dialysis, they don't have to go outside in these winter months. And then when they come back into the facility, they're placed in a quarantine for the safety of everyone because they leave the bubble of their room. So there are protocols and procedures in place that we've continued to modify and adapt. And we currently do not have any COVID in the building.
Excellent. Well, I just want to, again, thank you for your willingness to serve and applaud Eliza Bryant for the rich history and service that they have been a pillar in the Cuff community and a well-known entity. And so I think that, the skills that you have shared with us will be a tremendous asset. So with that said, I will open it up to my colleagues if you have any questions. All right. Well, it looks like you have covered your experience and your desire to serve well. So we thank you for coming before us.
Thank you.
If you would like to stay, you're welcome. And if you need to go, we certainly understand. Our next candidate is Yvette Bozeman. Ms. Bozeman, if you are on the line, if you will unmute yourself, give us a little bit of your background and share with us why you'd like to serve. Bozeman. All right, if maybe she had to get off, so we'll circle back. Christy Groves would be next. Christy, if you are on the line.
I am here.
Hey, Christy. Okay, so if you will state your name for the record, give us a little bit of background and share with us why you would like to serve. The floor is yours.
Yeah, of course. Thank you, Ms. Brown. Good morning, everyone. My name is Christy Groves. I am the Director of Resident Services with the Cuyahoga Metropolitan Housing Authority, CMHA. I appreciate the opportunity this morning. Of course, CMHA is the 7th largest housing authority in the country. We serve 55,000 residents across Cuyahoga County. Of those 55,000 residents, about 6,000 of them, just a little shy of 6,000, are seniors. We have 2 major housing programs. We have our low-income public housing program, and we also have our housing choice voucher program, which is formerly known as Section 8. In my capacity, I like to say that I'm the kitchen sink department. We are responsible for bringing in resources and different types of programming to our residents from the cradle to their golden years. With our seniors, of course, we work with a wealth of community partners to provide different programs and services to them. Of course, we work with a lot of healthcare partners, food organizations to get those needed services to our seniors to help them age in place. Of course, once they're here, they'd like to stay here. Prior to being here 10 years at CMHA, I worked for 9 years at the Department of Senior or Division of Senior and Adult Services in the Options for Independent Living program. So I'm very familiar with the work that DSAS does in the community, what they're doing. I'd like to serve on this board to continue to help to advocate and also to help bring resources, my expertise in housing, which I know is one of the strategic priorities of DSAS. I'm interested in just working with colleagues and those in the community who have the same goals as we do. And I'd also like to say, I think Mr. Miller and you, Ms. Brown, talked about different things that are happening with our seniors during the pandemic and COVID. We've been working with a lot of our community partners to provide access to the vaccine, of course, resources for food. We've been receiving a lot of donations. We have our own transportation department, which has helped us to help those seniors access different types of resources, especially with the vaccine in the last few weeks, working with the city of Cleveland and other healthcare organizations. So I'm excited about what we can bring to the table or what I could bring to the table as a board member. So I'm looking forward to that potential opportunity. Thank you very much.
Thank you very much. So you touched on something that I think would be, if you could elaborate a little bit more on the transportation component. I know a lot of times the individuals and the housing may have some transportation issues. So can you just elaborate on how that works, especially as it coordinating that with the vaccination efforts? Because I know we have two strategies in place. We have the county strategy where you call 211 and you can get some help, and then the city has their own number that they have to call. So can you just talk about maybe how well that is working, or if there's anything we could be doing better to help that work?
So for us, it's just a little bit easier because it's in-house. Our transportation department is in-house. So what we're normally doing is we're reaching out to our residents who are interested in doing different things, especially with the vaccine, and we connect them with our transportation department. But for those who are not interested in using it, of course, we work with our RTA, we work with other senior connection transportation resources to also assist with transportation. For us, the transportation is just, it's not a huge fleet. So people always think the CMHA can serve all the residents that we have. We have a smaller fleet, but of course, like I said, a lot of our seniors are not necessarily, they don't need the transportation. So, but we do work with other community partners as well.
And what size is your fleet? Just because sometimes I think, to your point, we have these grand expectations of some of our organizations, and it might, it might be helpful just to maybe mitigate some of those higher expectations if people are clear, and the people on this call can be, advocates or ambassadors, or at least, clear up any confusion as it might be, because I would expect you to have it's large and subjective. So you tell us what is in your what does your fleet consist of?
Well, we have eight vans, and normally we have like a 25 passenger van, and then the others are just 8 passenger, and they have wheelchair capacity. So for those who need that type of service, so it's only 8. It's not like RTA. People think that we have that, and we used to do shopping for seniors and things like that pre-pandemic. But now with the pandemic, we're not doing as much. We're doing only the things that are, essential, which would be vaccines. We have now services that take food and different things to our seniors. So now we're only using it like for different medical situations, especially with the vaccine. So it's just 8, and it's only for those individuals who definitely need it, like wheelchair accessible, for wheelchair accessibility, I'm sorry.
Are there, so the ADA, are there any age restrictions on it, or just primarily the
55 and older? Yeah, 55 and older. Now, if people need it, if they do need it, if they're not a senior, we will assist individuals, but we're trying to make sure that we're keeping people safe as well. We can't just load everybody in. So we're still limiting the capacity of those vans, so we don't put everyone on there all the time. Yeah.
And how many facilities does the CMHA consist of? How many
We
units?
have over 60 developments. Yeah, we have over 60 developments
And that's throughout the county.
throughout the county with, of course, with the housing choice voucher, those are 16, we have 16,000 vouchers. So they're, of course, located throughout Cuyahoga County as well.
All right. I'll open it up to my colleagues. Thank you. If you have any questions. Councilman Miller.
Yes, thanks, Madam Chair, and thank you for your willingness to serve. And my question is, if you could say a little bit more about how prevalent COVID-19 has been at the CMHA buildings, and also if you could say a little bit more about what you're doing to help senior citizens access the vaccines.
Okay, so we have, of course, we've had some issues with positive cases at some of our buildings. When we have seniors, which we have, when we have seniors that either have to quarantine because either they're presumed to be positive or they've been exposed to the vaccine, we have a case management department. So we have case managers who are actually assigned to different properties here at CMHA. And for those individuals, we make sure that we make contact and we have people that do to provide services to people so that they can maintain and stay in their units and don't have to come out. As far as the vaccine goes, we've been working, as I mentioned, with the city of Cleveland. Currently, right now, we're getting ready to do some work with also Care Alliance for those individuals who are, of the age group. We've been working with those who are 65 and older. So if they are interested in receiving the vaccine, which you mentioned, Mr. Miller, earlier about, how people are assisting those with accessing the vaccine. We don't have that many people who are very interested in taking the vaccine, which is not surprising. Some people say in the African-American community, when we first began this, our community workers, our case workers would contact those. The first group was 80 and over. We had 276 seniors, 80 and over. And of those 276 seniors, we were able to get vaccines for about a little over 20 of them. So some of them had already had it, some were just not interested. So that just gives you a little bit of an idea of how many people are actually interested in taking the vaccine, and we have helped. So we've had to date probably about just shy of 40 people. We've been working for the last 2 weeks, 40 seniors who have taken the vaccine, and we're still working with the city of Cleveland, of course, who will be providing the vaccine over the next few weeks as they get it.
So just one follow-up, when you've had positive cases at some of the buildings, do you have a contact tracing program where you go in and try to find out where the spread came from and encourage people who may also be at risk to quarantine? Do you have a program like that at CMHA?
So right now, we don't do any contact tracing ourselves. Once we find out that someone is positive, of course, we make contact with that person and try to discuss, any other places that they've been. But we also make sure that we sanitize the building so that if they have been anywhere throughout the building, it's hard to determine. Of course, people don't want to disclose sometimes because it's embarrassing if they think they have, if they do have the virus, they don't really want to disclose that, but it's not us who does the tracing. So we rely on the health department to do that, but we do make sure that we follow along in our buildings and make sure that those buildings are sanitized and make sure that there's anyone else in the building, any other residents, we still make contact with them, just to make sure that we don't tell them or disclose that someone has been, because we don't want to create an issue there as well, but we just make sure that we do sanitize and go behind that person when we find out that there are cases.
So just one follow-up, when you have positive cases, does the health department get notified?
Yes, we have our chief of staff, Mr. Jeffrey Wade. He works in that area. He's the one who is working closely with our health department on that. So I can't speak specifically to that, but I know that he does work with our health department for those of us, for our residents who have tested positive.
Okay, thanks very much, Madam Chair.
Thank you, Councilman.
Thank you, Mr. Miller.
Yes. Great.
Madam Chair.
Yes, Councilwoman Conwell.
Yes, through the chair to Ms. Groves. Has CMHA invested in some educational presentations for the residents to inform of the vaccine?
Yes, we've actually handed out, we've been handing out information. We haven't, and we do actually, our case workers, our case managers, they are working with some of our community partners to provide conference calls, which they put, like the city of Cleveland is actually getting ready to do some now around, and they've done some a few months ago, actually, several months ago when this first started, around just not only the COVID virus itself, but now the vaccine. So we are doing education around that. So handing out information and also providing conference calls for that.
Thank you.
You're welcome.
Thank you, Councilwoman Conwell. Any other questions from my colleagues? All right, Ms. Groves. Well, thank you. I think you have been, you've given us a lot of excellent information today. I think the community and the work that you do is so critical and during this pandemic. So you're truly an asset to this body, and we appreciate you taking the time out to join us and give us your background and your willingness to serve. So with that, again, if you need to part ways with us, we understand. And if you'd like to stay, we welcome that too. Our next candidate is Ms. Yavanka Hall. Ms. Hall, if you'll unmute yourself and give us a little bit of your background and tell us why you'd like to serve.
Surely. Hi, welcome everybody. Hello, how are you all doing? I'm Ivanka Hall. I am the Executive Director of the Northeast Ohio Black Health Coalition. The Northeast Ohio Black Health Coalition is the first coalition in the state of Ohio to focus exclusively on African American disparities. We look at racism, we look at health promotions, food insecurity, and a number of other issues that disproportionately impact the African American community. I have a master's degree in public administration with a focus on public policy from Texas Southern University. I also have a bachelor's degree from Notre Dame College, which is here in Cleveland. My bachelor's degree is on political science and history. I am a proud graduate of John Marshall High School, and I was inducted into their Hall of Fame maybe a year ago. And I was actually named the homegrown hero from the Cleveland Plain Dealer for our work to address food insecurity during this pandemic time. My organization has delivered 70,000 meals from my yard, delivering them to families who are at need, mainly a lot of seniors who are raising grandchildren who have special needs. We are trying to make sure that we keep them safe and keep them at home and in place and allow them to be able to have like all of the things they need without having to worry about leaving home, making sure that they have toilet paper and hand sanitizer and dishwashing liquid and laundry detergent and soap and candy for the kids and, snack bags and all of those other things so that our children don't feel disadvantaged and that our seniors don't feel overwhelmed, because it's a whole different thing to be dealing with something that that if something happens to our seniors that are raising young people, what will happen to our young people? And so for us, that has been paramount since day one. I am a woman who was raised by my grandparents after my mom was murdered in 1974. So my grandparents, my grandmother will be 90 years old on February the 23rd. She is currently in ICU at South Point. She was exposed to COVID by a young relative who just popped into her house one day a week ago. And so pray for my grandmother and pray for the other grandparents who understand around COVID. Seniors definitely understand. It's our young people that just aren't getting it because they're continually to put our seniors at risk. I am a mother. I am a grandmother myself. I am an activist, and I'm deeply impassioned about the issues that impact the community. I'm a member of various organizations, including the National Council of Negro Women, the Coalition of 100 Black Women, the Top Ladies, which are a lot of the women in those organizations are seniors. And so we get a chance to work with them and talk with them about the different things that are impacting their communities. I'm nationally recognized. I received 3 congressional awards for my work to address health disparities. I speak all over the country around effectively engaging the African American community, the art of community engagement. I consider myself an activist, a leader, an influencer, a speaker. I am a researcher first, and I guess in some parts of this world, I'm considered a philanthropist. enjoy the opportunity to speak on the issues that disproportionately impact the community, but not only speak on those issues, but act on those issues. So with our seniors, there are, the opportunity to serve here gives me an opportunity to assist with making sure that our seniors receive the best quality care, because it won't be so long before I'm a senior also. And so making sure that we're working within those systems to make sure that our seniors have the best care that we can provide to them. And I do know that they also have a food bank there that they've been providing food to seniors from the county out of the senior and adult services division. So that is who I am. And, and I've been doing this work for quite a long time. And I've lived in this county for my entire life.
Well, thank you very much. Your dedication and compassion and passion for your work is very evident. I've had the privilege of working with you on First Year Cleveland, and so that has been an honor and for me. And just I can vouch for the knowledge, experience, and energy that you bring. Can you tell us a little bit more? You touched on the 70,000 meals. Do you partner with anyone for that?
No, actually, this is my organization. So my organization started delivering meals um, March the 16th when we found out schools were closing, and there was no plan for seniors that or children that are disabled and their families. And so it was okay, well, let's figure out, what a plan is. Like we had to make sure that we pivoted in order to make sure that our children didn't suffer and that our seniors didn't either. Um, and so we started delivering food to families. We have volunteers that come from as far as Youngstown, Ohio. They come here, they line up in front of my house. We deliver a month's worth of food at a time, a month's worth of food and provisions. And then different folks just come in and volunteer. We literally have had hundreds of volunteers. I actually, while we're doing this, I actually just received a message from someone that says, I'm dropping you off 50 things of peanut butter and some Cheerios. And so I have a refrigerator on the back porch and a whole table set up, and people just drive down my driveway and they drop off things to the seniors and to our families. And so it has allowed us to be able to send out probably about 6 to 12 tons of food at a time.
That is amazing. All right. Well, I appreciate the work and the service that you provide to the community. I'll open it up to my colleagues if you have any questions for Ms. Hall. All right. Well, I think your reputation precedes you. I know you work closely with Councilwoman Conwell and some other circles. And so, and Councilman Gallagher is probably one of your strongest allies as it relates to the senior population. So you're in great company here. So you have gotten off pretty easy today, Ms. Hall.
Madam Chair.
So we thank you for taking the time out of your busy schedule, and I'll speak for myself. I'll certainly keep your grandmother as well as the extended family in prayer, and hope that she has a full and speedy recovery. All right. So
thank you.
You are very welcome. If you'd like to stay, if you have to go, we certainly understand. Our next candidate is Kathleen.
Madam Chair.
Yes.
I had a question, if I may.
Oh, I apologize, Councilman Miller. Absolutely. Please proceed.
Okay, so Ms. Hall, I was totally impressed by all your dedicated service and appreciate your willingness to serve on this committee. And my question is that our previous presenter, Ms. Groves, talked about the low uptake of the vaccine at CMHA, and I'm wondering what you feel could be done to help educate people about the importance of the vaccine and to help generate a greater acceptance and willingness to participate in taking it.
So one of the things that we've noticed in our work is quite the opposite. Our seniors are they've seen friends pass away from COVID related illnesses. And so for them, they're like, when is the vaccine going to get to us? And it's exactly the opposite of, that they don't want to take the vaccination. And so I think that, part of it is around who's informing them, where are they getting their information from, and making sure that they have the right information. Because a lot of times, being able to talk to them one-on-one, or talking to them over the phone, and alleviating some of their fears about the vaccination will help, particularly with our seniors, and particularly since that's the age group that we're vaccinating right now. Um, but yeah, we had a whole opposite. Like, we received tons of calls from our seniors trying to find out when they could get the vaccines. When would it be available to them? And so when it was available, it was okay. Now you got to reach out in order for you to be able to get it. And some of the buildings were really good. With working with like CVS, and then CVS coming over and administering the vaccinations to the populations that are in that building. And so I think it's just using our community partners, and then understanding that we have a lot of seniors who have low literacy rates, and that even though we may have seniors who have graduated from college, when you get as you age, your ability to receive different kind of information diminishes. And so that means that, where you were like fluid and able to fully understand certain things, as you get older, it gets a little different. And so for our seniors, we need to make sure that we're talking to them on a way that they understand that this is something that is good for them, that is going to help them, that if they do come in contact with the virus and they happen to have that the effects won't be as detrimental as they have seen. For me personally, as a woman who's 53 years old, I've lost 35 friends that graduated in 1986 between John F. Kennedy and John Marshall High School to COVID. Like, they're all people who are 51, 52, 53 years old. So their parents are the ones that are saying, I want to take the vaccination because they saw what happened to their child.
So thanks very much, and I'm happy to hear that the greater interest in the vaccine in the population you're dealing with, and appreciate your efforts. Thank you.
Thank you.
Yeah, to that point, and maybe you can just reiterate this. I think the more that people are seeing the devastation, and then also the more that people are seeing that the vaccine has not done any damage in our community, if you will, or that people are, taking it with some success, or having very minimal side effects, that the appetite for getting the vaccine is actually growing. So is that a safe summary?
Yeah, I think, that we have had some people who've had some side effects, but I think that that's with, anytime, even with the flu vaccination, we have people who have side effects. And so just when you look at it, the number of people that have to be vaccinated, and the smaller quantity that we're going to have that have side effects. Side effects are with everything. Everything that we take, there is a side effect. Some people will react positively, and then other people won't. This has nothing to do with Tuskegee or Henrietta Lacks or slave medicine. This is about how do you make sure that you are creating a way for your body to be able to fight, because this is something that does not give regard to race. It does not give regard to age. Like, it impacts everybody the same way. We've had babies that have died with COVID, and so we have to make sure that young people, and that people who think that this is like vacation time, for them to go visit other people's houses, that this is not. So the public, the message needs to get out, whether it's like plastered across RTA buses, because we still need to make sure that people know that they need to wash their hands, they need to social distance, and they need to wear a mask. As a matter of fact, wear 2 masks. I've been wearing 2 masks for 4 months.
Okay, thank you, Ms. Hall. All right.
Thank you.
No additional questions. We thank you for your time today. We're going to move to our next candidate, Ms. Kathleen Halsey. If you are on the line, if you will kindly unmute yourself, give us a little bit of your background, and share with us why you'd like to serve. The floor is yours.
Great, thank you. Good morning. Again, I'm Kathy Halsey, and I'm a program director for leadership development at the Cleveland Foundation. As many of you know, the Cleveland Foundation is the world's first community foundation, which has a mission to improve the lives of residents of Greater Cleveland in partnership with community members, organizations, individuals. And I would say that the Cleveland Foundation has a really long history of supporting older adults, but also supporting individuals living with disabilities. And so in my work at the foundation, and I've been at the Cleveland Foundation for the past 15 years. I joined shortly after my family moved here to Cleveland from Providence, Rhode Island. So we've been here now 17 years. But in my work at the foundation, I've had the privilege really to listen, learn, and connect and support community organizations and individuals focusing grant making on both basic needs, but also bringing innovative projects that grew from our community to really help with for older adults to live meaningfully and successfully in our community, as well as for those individuals living with disabilities. In my previous experience, I've worked in the federal government, focused on Head Start. So great to hear from our colleague who's now at Step Forward, but also some work on aging, et cetera. So for me, it would be an honor to serve. I've just been amazed by the expertise that I've heard from the other colleagues who are being considered for nomination. So it would be a great way for me to continue to learn, but also for me to, as a member of a community foundation, as part of some national boards, to make those connections and to share information and best practices and to share what's happening here with others. So it just would be a great privilege to serve. So thank you for this opportunity to be considered.
Well, thank you for joining us. How did you learn about the opportunity?
So, I learned of DSOS because we've worked with them. Tracy is just a great leader and all of her staff. I also participate, as I've heard on others, for the Council on Older Persons. So have just always been really inspired by the work that this county does for older adults and adults with disabilities.
I have to second your observation. The administration has done a fine job of the selection, and I'm sure you are no different. So I will open it up to my colleagues. If you have any questions, now would be the appropriate time. And it appears you will have gotten off easy today. So we thank you for your willingness to serve in this capacity, and we welcome you. We believe, we equally believe that you will also be a wonderful addition. So we're going to move on to our next candidate, Ms. Julie Johnson. If you are with us, and I see you here, welcome back, Ms. Johnson. If you'll unmute yourself, give us a little bit of your background and why you'd like to serve on this body.
Thank you. Good morning, Madam Chair and members of council and my former colleagues currently. Some of you I've worked with before in the past and others are new faces. And I echo Kathy Halsey's comment that I'm just honored to be among so many professionals this morning. The depth of expertise on this council is going to be amazing. I'm very excited for that. So I'm currently the CEO at Hunger Network, and Hunger Network is a collaboration of about 73 pantries throughout Cuyahoga County area. And we provide shelf-stable meals, and we also provide hot meals to go. So some of our sites are pantries and some are hot meals. And of course, during the pandemic, we've also been distributing all kinds of PPE and hand sanitizers and cleaning supplies for the pantries and everyone to maintain their safety. And I'm interested in serving on the council because I know that seniors have such a terrible time accessing food. We serve about 36,000 individuals per month, and about 29% of them are seniors. And so I'm really glad to hear some of the innovative ways that folks on this council have been reaching out to the seniors themselves, because we have been trying to figure out a way to reach out, perhaps through our food rescue program, to seniors who we know are sheltering in place because they're not able or they're afraid to get out to the pantries. And while some folks are bringing them food home, we know there's still being an unmet need. My concern has been, because seniors are such a vulnerable population, screening the volunteers who are actually delivering the food And that concerns me. Just with my background in history and Boys and Girls Clubs, we made sure all of our volunteers were always background screened, because obviously children and adults, seniors are very vulnerable. And so that's been a little bit of a blocking point for us. So I'm interested to hear from other colleagues how we can help get around that type of a hurdle and service our seniors better. So outside of Hunger Network, my history has been with mostly providing services for vulnerable populations, youth, and with seniors alike. And so prior to working at Boys and Girls Clubs, I had worked at Malachi House, which is a home on the near West Side for people who are terminally ill. And I was just amazed at it wasn't a recovery because the folks were terminally ill, but just the increase in health and well-being that these individuals experienced while they were at Malachi House, because they were provided with warm clothing, food, shelter, nutritious meals, basically all the things that they needed to meet. And I've seen Malachi House extend folks' lives longer and the quality of life, even though they were, terminally ill. So that's been a very rewarding experience, and I have that depth of insight to provide to the committee. And then I'm currently on the board of directors at Koinonia Homes, which is the largest servicer of people with disabilities, and they provide a variety of programs. So I've learned a lot about individuals who are seniors and individuals with developmental disabilities and the unique challenges that they've had, particularly during the COVID epidemic, with accessing healthcare and having their caregivers care for them and being isolated from the outside, the similar experiences that we're having. And then I guess finally, I had some law enforcement experience in my background. So a little bit of interest in there. And I certainly had a lot of protective service experience with doing wellness checks and welfare checks on seniors and children during that time. So all in all, I'm just pleased to be here this morning, and thank you so much for inviting me to participate.
Well, we're pleased to have you, and it's like I said, it's good to see you again, and it's good to learn a little bit more about your background and what you will be bringing to this body. It sounds like an array of talent and experience that will be a welcome addition to this group. So I will open it up to my colleagues if they have any questions as it relates to your candidacy or your nomination. And if there are none, which it appears to be, then we want to thank you for coming back. I know you've been with us a couple of rounds.
My pleasure.
You're going to be a part of the Cuyahoga County family soon. So we just thank you for your willingness to serve, Ms. Johnson, and coming on and sharing with the constituents of Cuyahoga County, the citizens, who you are once more and why you're willing to serve on this body. So with that, I'm going to move on to our next candidate, which is Janet Keeler. I'm going to say Janet. Janet, if you are on the line, I see you there. You can mute yourself. If you state your name for the record, give us a little bit of your background and tell us why you would like to serve.
Yes, thanks, Ms. Brown, and good morning to you and the rest of the Appointments and Equity Committee. Thanks for the opportunity really to serve on the board, but also to share a little bit about what I might bring to this committee. I am Dr. Janet Keeler. I'm a licensed psychologist. I work for the Cuyahoga County Board of Developmental Disabilities. And gosh, before I say anything about myself, I just want to recognize and appreciate that DSAS has been a valuable and valued partner with the County Board of DD for many, many years. Currently, my role here at the board is Division Manager of Community and Workforce Development. And as such, I oversee all efforts related to employment with individuals with developmental disabilities, community outreach, community engagement, and then once we develop those opportunities, how to help folks with disabilities access them. I've devoted the last 25 years of my career here at the board to individuals with DD as a licensed psychologist, also as an adjunct professor at Notre Dame College. I oversaw our forensics department for a number of years and worked in collaboration with the Cuyahoga County Court of Common Pleas, as well as all of the municipal systems in Cuyahoga County. Until very recently, in 2019, I oversaw all of the board's adult large adult activity centers and our employment services division. As such, in that large system, I completed systems transformation and organizational redesign to move all of those services for individuals with developmental disabilities to best practice. As a part of running those large centers, I also developed relationships with a number of senior centers and then arranged and paid for a number of contractual activities that were integrated between senior citizens and individuals with developmental disabilities out of those senior centers. As well, in 2010 here at the board, I brought an agency-wide performance management initiative similar to RTA's Transit Stat here to the board that we continue to use to manage outcomes as related to our strategic planning and our annual goals. I've also served on the Metzenbaum Sheltered Industry Board for 8 years in Cuyahoga County. So come to you with a good amount of board experience, including collegiality with multiple stakeholders, stewardship certainly towards cause and diligence and accountability towards organizational outcomes. So I am thrilled at the opportunity to serve on this committee to bring best practices and supports, not only for seniors, but individuals with developmental disabilities, but also I'm excited. We've got a number of great initiatives, innovative initiatives going on here at the board. And what works for individuals with disabilities will also work for our seniors. So looking to expand community access for community-based services for all of those populations. So again, I'm thrilled to be here. Thank you. We'll entertain any questions if anyone's got them.
Thank you, Dr. Keeler. So if you will highlight one of the initiatives that you are most excited about, that will be something that you're delivering right now that we can deliver to the senior population.
Absolutely. I'm so glad you asked. We, in October, I pitched here at the board something that we're calling shared virtual community. We know that, especially during COVID, but even prior to that, individuals living with their families or in congregate settings with staff supporting them, whether they be seniors or whether they be individuals with disabilities, have a hard time finding things in the community that they can access that are adapted for them and that they can easily register for, that are cost effective, and that have a vetted interest in serving those populations. So shared virtual community will be a interactive platform that will be found on our website, hopefully in second quarter 2021, that will have family members or individuals be able to go in, put in their zip code and find activities, interests, community groups, things that they enjoy by subject, by distance to their home, and be able to find all of those things in the community that have already been vetted by us as being interested and excited to provide adapted services for folks with disabilities and seniors.
Excellent. Thank you very much. I'll open it up to my colleagues to see if you have any questions. Colleagues? All right, Dr. Keeler, where it appears there are no other questions this morning. So I thank you for taking the time to join us and sharing with us your expertise and your background, as well as your willingness to serve. And with that, we're going to move on to our next candidate. I understand Ms. Janet Montoya was unable to join us. So Shannon Maniak, you are up next. If you would like to unmute yourself and state your name for the record and give us a little bit of your background as to why you would like to serve.
Okay, so good morning, everybody. I'm Shannon Maniak. I am the Executive Director at Services for Independent Living, which is based out in Euclid, Ohio, but we serve all of Cuyahoga County. And SIL for short is one of 12 centers for independent living in the state of Ohio, which really means we're mandated by the feds to provide a minimum of, like 5 core services to folks with disabilities, aging. We are cross disability, we are cross age. So we don't specify to one particular like age bracket or disability. We service everybody. So I learned about this opportunity. My predecessor actually was a DSAS board member, for those of you who knew Kathy Foley. So she retired in June. I took over basically her spot as the ED, although this is my 7th year with the agency. So I kind of feel like I've been through it all. I've seen it all, started in direct service here. So when Kathy retired, she said, you know, there's a really good opportunity for you to not only grow as a person, but grow as a professional and give everybody the things that you have seen since you were boots on the ground, as she always like to say. So I'm really excited for kind of like what I'm echoing everybody else saying, which is fantastic, which it's such a great opportunity to collaborate on a professional level for what all of these other agencies are able to do, and what we can all collectively bring together to make this county better. You know, and I didn't think Cuyahoga County could be better, but it absolutely can, and with the help of all of us. So I'm really excited for that. And then on like a selfish level, I'm excited because I'd like to see what I can do in my community. I'm a community member of Olmsted Falls, so I'd like to see what I can do better in my area for seniors and those with disabilities. I also am into my 3rd year of the Cuyahoga County Advisory Council on Persons with Disabilities. So I think, you know, I was born and raised in Cincinnati, went to Bowling Green State. From graduation, I moved to Cleveland and never left. So as far as I'm concerned, I'm from Cleveland. Even though family members are like, you can't say that, that's not where you were born. But I've spent more time here than I have in Cincy. So as far as I'm concerned, I'm a Clevelander. But I love it here, and I've always done direct service or voc training or something within like a social services arena. So I'm just looking forward to continuing that, and I appreciate the time, and I'm kind of in awe of everybody that's on this and has been appointed, and I'm just really excited. So any questions, I'm open.
Well, thank you. Thank you for your willingness to serve, and your enthusiasm is contagious. I saw a lot of people smiling. We welcome you as a Clevelander, and it's very kind of you to say that Cuyahoga County is great, but we definitely have a lot of room for improvement. So we welcome the feedback and the work that you've been doing in your current capacity. I'll ask you a similar question as Dr. Keeler, in your current role of what you've been doing with the developmental the DD community. Is there anything that you see that you can bring over from that work that you've done into this arena?
I would say the best way to answer that is going to be just kind of what we've seen with this pandemic. You know, I would say service delivery took a complete 180 for everybody when, you know, the pandemic hit. So for us as an agency, and what we've been trying to do, not only with folks with developmental disabilities, but with all disabilities, is how do we eliminate that social isolation? For us, we found that to be the biggest barrier. You know, there's transportation, there's healthcare, there's things like that. But for our particular our interest survey that we conducted with folks, it's that huge social isolation piece. So we've been trying to really tweak our service delivery to adhere to that. And we've been trying to come up with virtual service delivery. As weird and as hard as that sounds, is it doing like a book club? We've had some people that want to do book clubs. We've had some people that want to still learn how to cook, but how do we do it virtually, right? Because our particular mission is to keep folks with disabilities and aging independent in the community of their choice. So for them to maintain that independence is huge. So we've had to kind of take a real look at technology. But with technology comes the unknown. It's, you know, people don't understand how to use Zoom or iPads or things like that. So then we have that catch-22 of, well, how do you teach somebody when they don't want you in their house? So that's kind of, I don't even know if that really answered your question, but that's kind of one of the biggest things we've seen. But I like to even bring to the table at different meetings, you know, that ask those questions. Here's what we're seeing. Whether we have the answer or not, I don't know, but here's what we're doing in hopes that that answers, you know, the gap that the county is seeing.
Yeah, so they're definitely
answer that.
That's helpful. It's definitely helpful. So what I would just as a follow-up, living in Olmsted Falls, which I have the honor of being on the Planning Commission, and we do a lot of work, I believe in that in your community. So a lot of new development, but can you speak to if the digital divide exists there? Because I know it seems like there's constant need for approval for infrastructure as it relates to sewer, but just curious as to digital access. So if you could touch on that very quickly.
As far as it relates to the vaults?
Wi-Fi and internet access, is that
gosh.
Community?
You know, that's also another really tough question, because I feel like there are, no matter who you have, Verizon or AT&T or whatever they market, there's always going to be those black holes. I will say personally, if you're asking specifically in Olmsted Falls, we have some serious holes with Wi-Fi connection. And not only does my agency serve Cuyahoga County, but we do also serve Lake and Geauga County. So we're out in the rural sections where even more, use of technology is important, but there's also those holes. But we've tried really expanding our own budget and looking at grants on how can we help that. So it's getting those tablets out to the folks that need them. And not only that, maybe it's a hotspot. But then with one problem comes another, because then it's, well, now I can't afford my internet all the time in this hotspot. So we're always trying to come up with different things, but definitely looking at where those holes are in service is also, it's a constant battle. I don't think that answered your question either, but yeah, we ask ourselves those questions literally every week.
That is helpful. I think in the work that I've been doing, we really have a great emphasis on the urban core, but I also recognize that in some of the more rural areas or the outer ring suburbs or the further out you go, that this also becomes an issue. So I appreciate you being able to speak to that. So you did answer my question. Okay. So I thank you. I'll open it up to my colleagues if there are any additional questions. Ms. Maniak. All right, Ms. Maniak, it appears there are none. So we thank you for coming.
Thank you so much to everybody.
And we're going to move on to our next candidate, Douglas Tayak.
You had it right the first time, which nobody ever gets. So.
All right. So if you'll state your name, give us a little bit of your background and share with us why you'd like to serve.
Sure. My name is Doug Tayak. Formerly it's Douglas, but I always shorten it because Douglas brings back too many memories of my mother being mad at me. So for the last 10 years, I've served as the Associate State Director for Outreach with AARP Ohio. I cover 24 counties in Northeast Ohio, but my focus is Cuyahoga County. It helps to the lifelong Cuyahoga County resident, grew up in Cleveland Heights. My wife and I bought our home in Shaker Heights, where we are now, Council Ward 9. So my focus is really delivering ARP's social mission in Northeast Ohio and serving the needs and addressing the concerns of our 105,000 members in Cuyahoga County and about the 385,000 member households that are in my region. And we have 1.5 million across the state. So we were actually approached by DSAS because they believe that having done work with DSAS directly, but also with some of the other organizations that are represented here and are part of the DSAS board already, that having an ARP voice on the DSAS board was important. I agreed wholeheartedly. My boss echoed that sentiment. And we both felt that, my boss and I felt that I was the best person to serve in that capacity if, chosen by and allowed to serve on the board, with the council's vote. So that's how this came about. That's why I'm here. I believe wholeheartedly that DSAS is doing tremendous work, especially in the face of the pandemic. And I think that AARP, through our ability to connect with our membership, through being a trusted source of information, we can help bridge some of the divides that have been talked about here, that I've, as I've listened to everybody else's contributions here. And so I think that's an important component that we bring, is that access to our members, the trusted voice that we have, and the ability to partner with, great organizations who are doing great work to better the lives of older adults in Cuyahoga County. So I have a bachelor's from Kent State and a master's from the University of Akron. And like I said, I've been here, all 38 years. So I'm happy to take questions from you, Chairwoman, or anybody else from the council. So.
Well, Doug, it's good to see you again. It's been a while.
Yes.
We crossed paths when I first came on to County Council, and we had a nice meeting over at the Marriott, if my memory serves me correct. So it's been a while, but it's good to see you. And I know the passion and the work that you will bring to this position. So I'm excited about your candidacy. And so I'll open it up to my colleagues if there are any questions If there are any questions for Doug here. All right, Doug. Well, I think your association with AARP probably, along with your presentation, speaks for itself. So we are excited to have you. I welcome you, and I thank you for coming and sharing your time with us and giving us a little bit of your background and why you like to serve. You're welcome to stay if you like, and if you have to go, I certainly understand. But again, it's great to see you again. It's been a while, but I'm glad to see your face here, and I know you'll be a great addition. Our next candidate is Kim Thomas, who is also a familiar face and friend to me. She is Councilwoman of Richmond Heights. Kim Thomas, if you will unmute yourself and give us a little bit of your background and share with us why you would like a little bit about your background and why you'd like to serve. The floor is yours.
Thank you. Hello, everyone. As Chairwoman Brown said, I am Richmond Heights Councilwoman. I'm a small business owner, and I also am the executive director of Change of Direction. It's a nonprofit to serve at-risk youth and also families in need. But I want to start off by just thanking Chairwoman Brown and members of the council for allowing me to present today. For me, it's real easy. Why do I want to serve? The answer is simple. This is what I've done my entire life. Serving on this board will allow me to continue my mission and to have a more of a wide impact. The other part is I believe in the support and empowering the seniors and adults with disabilities. The seniors are the shoulders that I stand on. So they also, and this is kind of selfish, they also help me to create my legacy. And my legacy is to impact the lives for the better. Most of you guys know my heart. I have a servant heart, but I have a business mindset. And that is what advising really is about. And I know the work, but I also see and understand the need of the people. And I'm fully committed to protecting the rights of my seniors and adults with disabilities. Now, as a sibling of a person with physical disabilities, I learned to be compassionate, understanding, and respectful of my sister's needs. And I have supported and advocated for her my entire life. So service, again, is what I do. I host a monthly pantry here in Richmond Heights. And last year alone, we partnered with other community partners, and I was able to provide the community with 126,000 pounds of food. Now, how do I know that number? Like I said, I partner with community partners. I got my yearly report from the Greater Cleveland Food Bank, and they said, hey, congratulations, you have served in Richmond Heights 126,000 pounds of food. And we made special deliveries to our seniors and our adults with disabilities. And I currently partner with UH in Richmond Heights. So what they do, they actually give me the bags to put our produce in, but they also provide us with the masks, the sanitizer, hand sanitizers that we can give to our seniors and the community. But for the seniors and the adults with disability, we do something a little different for them. We do special home deliveries for them. And I just want to say kudos to Judy Johnson, because she is also one of our community partners, the Hunger Network. So in closing, I just want to, most of you guys know, I am truly a team player, but I believe in collaboration. I think it's essential in order for us to accomplish any goal. So I humbly ask to be considered for this board. And if there's any questions, I'm here to answer.
I don't have any. Like I said, I know Kim very well. When we first crossed paths, one of their very main high priorities was how can I get more involved with the county and how can I get on this board. So I am excited for you. I know this is something you've been wanting to do for quite some time. So I know you'll be a great addition. So I'll just open it up to my colleagues. And I think most of them are also, like you said, very familiar with you. So if there are no questions, I thank you for joining us today, my sister. And if that is it, we're going to go to our final candidate for this portion. Well, no, I see Ms. Bozeman has come on board, but we're gonna circle back to you, Ms. Bozeman, so you get a little time. My next candidate is my friend Bishop Eugene Ward, who might fancy himself as David Ruffin. That's one of our little inside jokes. Once you hear his voice, I tease my pastor because I'm like, you can't hold a candle to the bishop. So Bishop, if you will unmute yourself, give us a little bit of your background and share with us why you like to serve on this body, please.
Thank you, Chairwoman Brown, and thank all of you for just being so patient and staying on here. I know a lot of you who are on this call. My background, I've been a pastor here in Cleveland for 38 years, born and raised right here in Cleveland, left Cleveland for 10 years to go to Georgia, to go to Morehouse College and pastor in Georgia before coming back home. And I've been very active. I have to deal with a lot of seniors on a daily basis, not only at the church, but just going through the community. Those of you who work with me know that I'm very active throughout the community, and I'm continuing to hear the problems of seniors that are in this community and adults, because I think that we don't need to forget adults as well as seniors. They are both very important. The problems that they're having in paying taxes, problems that they're having in keeping up their homes, problems that they're having now with having to take care of grandchildren. There's so many issues that are before them. And COVID hasn't helped it, even though I did get my second Moderna shot on yesterday. So I am concluded with that process as for now. But I do want you to let you know how important it is that we are able to listen to these seniors, because many of us, if we're not already there, we will be there soon. And we've got to be able to listen to them. Last week, I buried 8 seniors. And the fact that we're going through this kind of trauma in our community and not really listening to their needs. Many of them are living alone, and we've got to try and get them the help and assistance that they need in order to be able to make sure that we are helping them and addressing their needs as they let us know what they are. We can no longer just sit in our offices and in our organizations and not get out here to make sure that we reach the people whom we are supposed to serve. I have a servant's heart like Kim Thomas. That's been my life, to make sure that I serve. And I'm looking forward to serving on this committee with this board with seniors, about seniors and adults. And that's all. You said 3 to 5 minutes. I'm going to keep it within that time.
Thank you, Bishop. It appears that Councilwoman Conwell has unmuted herself, so I'm going to just turn it on over to you, Councilwoman Conwell. Did you have a question or comment for the Bishop?
Bishop, you do a lot for the community, and I just want to thank you and the rest of the participants that have stepped up for the seniors. There is so much need just in that category alone. We've heard of the digital divide, which I've been very passionate in trying to push and get more funding for. Food, of course, and now we have this vaccine before us. So I thank you for all that you do, and please continue to serve. Thank you. Thank you, Councilwoman.
Thank you. Thank you, Councilwoman Conwell.
Yes. I second that you are definitely one of the pillars in the community. And if there's any place to be, you're there. If there's any place to be where people need to be served, you are always there. So we honor and we appreciate that. If there are no additional questions. Yes, Councilman Sweeney. Hello, you have the floor.
Thank you, Madam Chairwoman. To the illustrious Bishop, it's nice seeing you again.
You as well, sir. Welcome back home.
Yes, I thank you. I'm looking forward to working with you again. We did a lot of good together, and you never stopped. I just want to thank you, and I'm looking forward to it. You helped make this board more well-rounded. You're going to play the role that you always do, keep things together, and keep the single focus on taking care of the business of the committee. So, Madam Chairwoman, I'd like to have the bold request that have my name added to this legislation so I can always remember or remind the bishop that I voted for him.
Yes, Clerk Johnson will take care of that. So we will have that. Are there any additional comments or questions, Councilman Sweeney? Okay, it appears.
But on a point of personal privilege with Janet Montoya, she's my county council. I'm her county council person, and she's a member of Ward 13 in the city of Cleveland. I just want to give my colleagues a recommendation. She's a wonderful young lady, and she'll make a great addition, and I'll vouch for her as much as anybody wants me to. I can answer any questions about her as well. Thank you, Reverend.
Okay, we appreciate that. We'll circle back to Ms. Bozeman at this time if there are no additional questions, comments, or concerns for the bishop. All right, then Ms. Bozeman, you are on deck. You feel and unmute yourself, state your name for the record, and give us a little bit of background and why you'd like to serve.
Well, my name's Yvette Bozeman. I was recently remarried. So it's Bozeman Wright. I am
married Mr. Wright. You found Mr. Wright.
I found Mr. Wright.
Okay, I couldn't resist. Okay, I'm sorry. Go.
No, I needed that. It released a little tension. So thank you for that, Ms. Brown. Well, I want to be a part of this board. You know, I've worked with seniors more than 20 years. I am coming through from the long-term care industry. I have a passion for what I do and just making a change in the healthcare industry. Being a part of the seniors has made me realize this is my calling. I like to be, it is a reward to be able to serve the residents and their families and just to guide them through the process so often needed when coming to long-term care. So it's that I try to be of assistance in any way that I can to their family members, the residents, and also the staff. You do this for so long and you like to think that you're helping everyone involved. And with that comes everybody, the staff, their family members too, and then most importantly, our residents and their families. So I don't know what more to say other than that, other than me enjoying it because I see the rewards that we're able to provide to them.
Well, thank you very much. And just for the record, we did know that you had a previous engagement, so that was why you weren't able to make the original request to make your presentation. But that's because you are working. A lot of us, it's the people who are always doing the work. You know, they're here, there, and everywhere. So we just appreciate your willingness and your servant spirit. And I will open it up to my colleagues if you have any questions for Ms. Bozeman Wright. So I have a sign, I'll tell you this, that I gave my Mr. and it says, he's Mr. Right and I'm Mrs. Always Right. So all right.
You need to give me that one also.
I will make it a point. You send me your information, I'll get one for you. So if there are no other questions, we are closing out that section and then we're going to move to our reappointments. We thank you again for coming, and you may not have heard my remarks at the top of this meeting, but it is important that our constituents and citizens have a face to put with the name and hear directly from them. We really take that part of this committee very seriously, especially during a time such as this when we're dealing with the pandemic and the technology and use of virtual meetings are right at our fingertips. So we appreciate you making the accommodations to join us today. So thank you very much. And with that said, we're going to move to our next candidate who he's the second runner up for the Marathon Award, Bill Hebel. I hope I said that right. If you'll unmute yourself and give us a little bit of your background and share with us why you would like to serve.
Good morning. Thank you, Madam Chair. It's really been a blessing to be here this morning. I mean, my goodness, what an exceptional slate of candidates we have, for the advisory board. I really appreciate, the opportunity to be considered for reappointment. Very much looking forward, if possible, to work with all these exceptional professionals. My name is Bill Hebel. I am currently blessed to be employed as the Client Rights Officer for the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County. In my role there, I have the opportunity to advocate for our clients, both in the mental health and substance use disorder system, to ensure that they receive the best services possible. I also currently serve as the vice chair to the DSAS advisory board and as chair of the advocacy committee. So again, I appreciate the opportunity to be considered for reappointment. If possible, I'm very much looking forward to continuing my work. Working for the Adams Board, I have the opportunity to really advocate for individuals and agencies. Being able to be a part of DSAS, that really gives me the opportunity to further my advocacy, beyond the individual and agency, and also more to the community and systems level. So much great work has been done by DSAS, particularly in light of the pandemic. Things that often that we're concerned about, that just exceptional work has been done around food insecurity, making sure there's home delivered meals to those in our community. I know there's been a lot of talk this morning about the digital divide. And, unfortunately, older adults are disproportionately impacted by isolation. So, DSAS working diligently with their staff members, making sure that, the clients in our community, that we're networking with them, that we're interacting with them, that they're not, left on their own to the best of our ability. So we will continue, if reappointed, to work to bridge that digital divide, to keep our clients actively engaged, making sure that they have the services that they need. So I'm very much looking forward. I hope to be reappointed, to continue the work, and I'm happy to entertain any questions. Thank you, Madam Chair.
Thank you. Thank you again for your patience in joining us today and your willingness to continue serving in this capacity. I may have missed it. Is this your second term? How long had you served with the body prior to this opportunity to be reappointed?
Absolutely. This will be my second term. I was originally appointed in January of 2018 and recently took over as vice chair of the advisory board this summer. So again, looking forward to continuing that if possible.
Wonderful, wonderful, wonderful. I will open it to my colleagues. It appears Councilwoman Conwell has a question.
Yes, thank you, Madam Chair. To Mr. Hebel, I'm glad you said you were on the advocacy committee. What has the advocacy committee done in regards to educate the seniors virtually about the vaccine?
Very good question. Thank you, Councilwoman. I appreciate that. The vaccine, we've talked about it all morning, and what a challenge, it's been. Our advocacy committee made the decision early in the pandemic to begin meeting on a weekly basis. We just decided that, meeting, monthly or bi-monthly just wasn't sufficient to be able to keep up with the updates. So, that trend, has continued, throughout the summer months while, the vaccine was being prepared. We're working very closely with Tracy Mason, DSAS administrator, and other DSAS staff to make sure that correct information is available, working with the clients so they know how to go about getting the vaccine, where that vaccine will be available, educating them as to the safety of the vaccine. Tracy Mason has been putting up various public information and various posts regarding the vaccine to educate the agencies with whom DSAS contracts, educating clients in the community so that we can get this information out to the best of our ability. The Adams Board has also been working with that as well. Right now our group homes are among the list of those that are eligible to receive the vaccine in addition to older adults in the community. So we've also been working with the group homes, providing that education, providing contact information with the Department of Health so that they know whom to contact so that these vaccines can be arranged.
Thank you, Mr. Hebel. A follow-up, how many seniors do you have that are active virtually? Do you know that DSAS has?
I'll be honest, I don't know the exact figure. I know we have quite a few that are active. I don't want to venture a guess as to the exact number and misquote. So I can certainly have that information for you. It would be available in the annual report.
Okay, thank you.
Thank you, Councilwoman.
Thank you, Madam Chair.
Yes, thank you, Councilwoman Conwell. Are there any other questions for Mr. Hebel from the committee? All right, Mr. Hebel, well, thank you again. You get the second runner-up award for the Marathon Award. And with that, we're going to move to Carolyn Lookabill. And if you are with us, Carolyn, you are the champion of the day for the Marathon Award. And if you'll unmute yourself and share with us a little bit about yourself, state your name for the record and why you like to serve.
Madam Brown, this is Maridel Couture with DSAS. I am not Carolyn Lookabill. She is in a meeting, an emergency meeting, and is unable to join us today. If you like, I can give you some background information.
Yes, if you would, please. That would be very welcome.
Carolyn is requesting a second term. She has been with the board for 3 years. She is the director of assisted living operations at Providence Healthcare Management. She, in her past, has volunteered with the Hospice of Western Reserve. She's been the board president of the Alzheimer's Association, the Cleveland chapter. and currently is a member of an 8-area networking group for senior living professionals. Carolyn has been very involved with the annual Cuyahoga County Conference on Aging that this year will be done virtually and will be an aging summit. So she's been very involved with our Education and Resource Development Committee. She brings to us definite skills in marketing and in community building, and we recommend that she have a second term.
All right, thank you very much. We appreciate that. We know that she has been doing this work for quite some time, so we're a little bit more lenient when it comes to our reappointments and our appointments. So I will take that into consideration. Additionally, you notified the body that she was going to be called into this meeting today. So we will certainly take that into account. So I thank you for presenting on her behalf. I'll open it up to my colleagues if you have any questions. Okay, it appears there are none. So thank you for joining us. At this point, since we have gone through our entire list of candidates, I would like to make an omission of 3I, which is Janet Montoya. We'll hold that one. I understand she is ill. I think we owe it to the citizens as well as this body who have made the accommodations to join us to give her that same opportunity. So we will wish her a speedy and full recovery, and we will entertain her nomination at a later time when she is able to join the call. Do I have a second for that amendment?
Second.
All right.
Conwell.
Are there any questions, comments, or concerns? All right, if there are no questions, comments, or concerns on the amendment, all in favor, please say aye. Aye.
Aye.
Any opposed? All right. I know that we've also got the majority of the appointments have been in place. So I'm assuming these need second reading suspension, Director Pomerantz?
Yes, please.
Okay, all right. So I'll make the motion to move these to the full body of the council under second reading suspension. Do I have a second?
Second, Sweeney.
All right, it's been seconded by Sweeney. If moved and seconded, if there are no additional questions, comments, or concerns, all in favor, please say aye.
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 Opposed? All right. This will move to the full body of the council under second reading suspension. I thank everyone again. To the administration, hats off. What a dynamic and thorough, impressive, and well-experienced nomination class you have presented us today for this great work that we need, that is very, very critical during this time. So hats off to the administration and hats off to all of our candidates for your willingness to serve in this capacity. It is great work that you are embarking upon, and this county and the council really appreciates it. So if there's no miscellaneous business, is there any miscellaneous business? Councilman Gallagher, you have.
Madam Chairwoman, thank you for today, and I thank all of our candidates for today. And as you had mentioned, I kind of kept my powder dry until the end because I didn't want to be repetitive. But if I can encourage those that have been moved forward, my encouragement would be to push every button that you can push. Pull every lever that you can pull. If you have to go to the bat rack, pull out a big bat and start swinging it, because we need to move forward in Cuyahoga County. If there's one thing that has struck me in my elected period of time, which has been unfortunately substantial for some people, is that I've seen where this works for seniors. And in my city of Strongsville, I saw where it works. And the reason it worked was because everybody wanted to do it. But the important thing is then we did it. Everybody in Cuyahoga County wants to do it. But the unfortunate thing is, at least on the elected side, and I include myself in not being aggressive enough or maybe too aggressive, but it just doesn't get done. We need to look to Franklin County as to what we need to do. They're spending 7 times more on their seniors and their senior programs than we do. They have less seniors than we do by over 100,000. Our age up here, we're getting older, and I don't believe that we're recognizing that quickly enough. the age bomb, and I'm becoming part of it, has exploded. The need has not gone away. Indeed, with the virus, we have been exposed to greater need. And I'm hopeful that all of you today can push us in elected chairs to move forward tomorrow. Good luck, and I really pray that we can move senior programming and senior issues to the forefront. Thank you, Madam Chair.
No, you're more than welcome, Councilman Gallagher. As I like I said, I indicated, this has been an area of great advocacy of Councilman Gallagher. I tease him. I think it's because he's closer to the senior population. He's trying to set himself up for, no, I'm just kidding, but we're all going to get older. And so this is great work. And so I am an equal ally in this work. And that is probably a mild request from Councilman Gallagher, because he has been a fierce advocate for the senior community. And so it is incumbent upon us as members of this body, of the council, to use our political will to make sure that we are putting the resources into this community that is so rapidly growing. So I echo your sentiments, Councilman Gallagher, and I thank you for your remarks and just reiterating the importance of the work that this body is about to embark upon. So with that, if there are no additional comments and no additional miscellaneous business, this meeting is adjourned. Stay safe, warm, happy, and sane. It's a crazy world out there. All right. Take care, everybody. Bye.
Thank you.
See you, Bishop.